Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. A person wrote in and said, I was diagnosed with Asperger's. I was prescribed risperidol for 7 years now. I have tardive dyskinesia. What could help? Does CBD oil help with tremors, anxiety, and to help me relax? I'm 20 years old, and they say that they're being made fun of and they're having trouble making friends. And any suggestions?
Oh, yeah, that is upsetting. And so I don't know if you are on Risperidol right now. It's unusual to have Risperidol when you have a diagnosis of Asperger's. But and I'm really sorry that you're struggling with tardive dyskinesia as a result of that. I feel bad about that for many reasons. So what I would suggest, yes, CBD oil does help some people, I have heard, but there are so many other things that are more effective than that I would recommend if you're experiencing anxiety. There's lots of other things that are effective. So what I would suggest, and anxiety is a big deal in our world. Let me just say that not only is it like very prevalent now due to all the conditions of life having changed, but in the world of autism, it's one of the main things that we are challenged with. In fact, a good friend of mine, if you guys are on the Autism Research Institute, Steve Edelson, together with another good friend, Jane Johnson, just wrote a book on autism and anxiety and how to manage anxiety within autism. I'm a very big believer that anxiety plays a very significant role in autism. And so what I would suggest is that you go down the path of doing the things that would be helpful for anyone, Asperger's or not, who has anxiety. And so the things that work the best for anxiety are a combined treatment of medication and therapy. Now, medication, usually you're looking at, again, what I was talking about before, SSRIs or SNRIs. There are other types of medications as well for acute anxiety. But remember, don't get confused, because the medication for depression and anxiety is the same. So they're actually called antidepressants, but they are the same medication that is used to treat anxiety, and they're extremely effective on both. But there's many different types, and you have to go through the different types until you find one that is effective. Because each of these medications has just a different chemical shape. So Prozac might not work, but Lexapro will, or Lexapro might not work, but Cymbalta will. You have to kind of consult with a psychiatrist and look at that. And it's very important, because once you get the right medication, it is incredibly effective. So now I don't think that alone is sufficient. The other portion of this is therapy. And depending on what works for you, you choose the type of therapy. The common therapy that everybody says that, scientifically is the most effective is what's called cognitive behavior therapy. It's very similar to ABA, but it's kind of a little bit more advanced. So it gives you exercises that have to do with identifying, for example, what are the things that make you anxious? And then when that thing is in your environment, you will have various other activities that you should be doing during that time. You'll have mental exercises like not just things like breathing exercises, but also things like visualizing a very peaceful environment or things like that, that'll help you, overcome that moment of anxiety. And if you learn these techniques and you're taking some form of antidepressant, together, you will definitely overcome the anxiety. And honestly, it might even help with the tardive dyskinesia, because a lot of times tardive dyskinesia is paired up together with anxiety as well.
And then in terms of the not, being made fun of and not having friends, I do want to say that they also wrote in and said that they've been taken off of the risperidol because of binge eating and massive weight gain. And now since I've been off it, I've lost 120 pounds.
I'm so
What
proud.
an amazing thing. Yeah.
That's incredible. And be careful. Losing that much weight in a year is a lot. So take it easy on your body. But that sounds pretty amazing. Congratulations right there. Now, yeah, let's talk a little bit about that whole making friends and being made fun of and all that sort of stuff. That's kind of a more complicated situation. And, I could tell you a lot of things that you could do, but at the same time, to some extent, being made fun of and all that is not your fault, it's their fault. So it's kind of like you do the best you can socially, but there are going to be people out there who are not empathetic, not sympathetic, and, not kind. And we all experience that to some extent. Yes, it's more difficult. Everything you're going through will make things more difficult. I do recommend, there are some, and do we know the age of
20
20?
years old.
Yeah, so I think you should also contact the peers program at UCLA. If you, do have an online social group. In fact, I think there's more and more of these online social groups for adults with Asperger's that are developing now, where you will have like 3 or 4 or 5 or 6 adults with Asperger's on the screen, as well as a moderator who is helping make sure everybody's communicating okay. And that might be a easier, more comfortable way to begin socializing now. And the peers group at UCLA will definitely give you guidance about their program, as well as perhaps other programs that you could join.
Wonderful.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.